Okay, welcome again to the monthly The Mold Pros webinar series. This month we have Dr. Gordon Crozier, who is a practitioner out of Florida. He's been working with us for a long time, and he really works on how toxins interact with the brain and neurons. And there's a lot of papers out. I would say that if you did a search over papers on environmental toxins, you'd find them in the thousands. So it's a very established modality now. But unfortunately, there's not a whole lot of treatments involved for this. But luckily, Dr. Crozier is kind of on the forefront of these type of things. I would say that the owner of our company, John Bodie, he says that if he has any questions or issues, Dr. Crozier is always the first person that he always wants to call. So I'm really happy to have Dr. Crozier on our monthly webinar now. So I'm going to leave it to him to lead us into how to deal with these health modalities, dealing with toxins and brain health. Thank you, Dr. Crozier.
Well, thank you. Well, this is kind of a lecture that I'm going to skip through some of the slides because they might get a little bit complicated. But this is a lecture I did recently to educate physicians. So I love educating physicians. So I am actually faculty for A4M. I'm also on with several universities in training physicians. So I like for people to understand what's going on. So my modality, because I was a physician assistant before I went back to medical school, I worked in neurology and neurosurgery. That was my primary area of interest as a physician assistant. So then when I went back to medical school and then actually figured out my own health problems, which happened to be secondary to mold, I realized that this is a whole entity that is not really dealt with enough. There's more doctors now dealing with it, thank goodness. But originally I had really very few people to go to, and there were very few articles. Now there's much, much more that we have available to us. A lot of the original research actually came out of Europe because they were kind of dealing with a lot of these things first. So I've been doing this for 12 years. So let me see how to make this advance. Let me see. It will not. So I use something called metabolic code. It's kind of my pre thing that I use a lot of time in my survey. So there's a survey, and then there's some labs that you can do. And so what I do is this helps me to see what area and what triad in the body is going to be actually affected the most. So this person actually was a patient that I saw last week or the week before. And this patient actually, you can see that their gut, brain, and immune system was actually the worst that was affected. And then when we delve a little bit deeper, it was actually when we came out to the full fact, they had lived in a moldy environment for some time and were actually dealing with some other environmental issues. This is one of my favorite sayings, so I have to start with this. And this is a Thomas Edison quote: "The doctors of the future will give no medicine, but will interest his patients in the care of the human frame, diet, and the cause and prevention of disease." So I like to look for cause and prevention. So what can we do for cause and prevention? So I just want to go a little bit into what causes these mycotoxins, the gases put off by the plethora of molds that we have in our society today, and the plethora of environmental toxins. So you have to understand, it's not just the indoor molds that could be causing an issue. There's indoor toxins, and these are put off by drywall, by your wood floors, by other things, by chemical cleaning agents, by pesticides, herbicides, you name it. These things are in our homes. And so what happens is the innate immune system is activated by these chemicals, and then the microglial cells are activated as part of that innate immune system. So typically the central nervous system or your brain is privileged or immunologically privileged by the blood-brain barrier. This is broken down. It becomes broken down. So neuroinflammation is actually known as a chronic disease state, not an acute disease state. So this happens over time. So that's why you need to get it first. The two main neuroimmune responses are the glial cells cause activation of the microglial cells. And the microglial cells, they're a specialized population of macrophages. They actually will get the leukocytes and the macrophages peripherally to come to the brain and cause neuroinflammation. This also causes destruction and injury to the blood-brain barrier. So then all these toxins that you're exposed to, they begin to increase in your brain and neurologically. So a lot of times I will have a lot of my people, they come and they say, you know, my brain feels like it's swelling. It feels like there's all kinds of issues. So these are cytokines, they're a class of cytokines. So they're proteins that regard inflammatory signaling. So chemokines regulate cell migration, but they both are produced in the microglial astrocytes and the endothelial cells peripherally. So this is kind of a little thing that's kind of gets complicated, but it kind of says how these chemicals will cause your IL-4s, your IL-6s, your IL-10s, your TNF-alphas, your TNF-betas. All these different things will cause, because of the chemicals, these inflammatory cytokines then cause you to become inflamed neurologically. So these are the inflammatory cytokines, which you don't need to know, but perhaps your physician does, because they need to actually look at these. And these are cytokines that I look at to see which ones are inflamed secondary to these. So we also want the anti-inflammatory cytokines. That's what we want to accelerate in an inflamed brain. So to bring down that neuro response, that neurological issue. So we need to regulate that. So the cytokines are class A proteins that regulate inflammation. And so genetics also play a part. And I know probably a lot of you, because a lot of the doctors are looking at specific genetic SNPs for people that are having like mycotoxins. So there's something called HLA-DRBQ, and that specific genetic SNPs can actually say that you are a mold sensitive patient. So now what they're finding out with that whole HLA-DRBQ is even if you have just one abnormality with that can lead to you having a difficult time removing these mycotoxins or these mold gases put off by the molds removed from your body. And that will lead to cognitive issues. So we have to understand we're dealing with possible genetic issues in some of us. These other genetic things like FTO, FADS1, CYP1A2, ALDH2, these all control oxidative stress. So these toxins create oxidative stress, and we need to pull down this oxidative stress in our treatment modalities, because we need to, number one, remove the insultive agents. And I'll tell you a little bit on how I do that. And then what we need to do is then address the oxidative stress. So the HLA-DRBQ, this puts you at risk for something called CIRS, or chronic inflammatory response syndrome. The WHO, which we all know because it's in the public all the time now, actually has two entities for CIRS. One is called without organ involvement. The other one is with organ involvement. So I typically see everybody with organ involvement because most of my patient population has already been to 22 doctors before. It wasn't correctly diagnosed. It was partly diagnosed, and they didn't know exactly how to get rid of some of these insulting agents. They didn't understand the mitochondrial involvement of these agents. And so then what happened to them is they kind of were left partially treated or not treated at all. And so they've already been around the block. So my people usually have organ involvement with that. And so that's, but in the United States, we only go by CIRS. That's what it is. And that's an ICD-10. It has an ICD-10 code. However, insurances don't like to pay for that ICD-10 code, but it does lead to, all these things lead to neuroinflammation. So there's also these other genes, the ApoA, ApoB, ApoE. So if you're an ApoE3/4, that usually puts you at risk, or an ApoE4/4 puts you risk for cardiac risk, but it also puts you for neurological risks. So people exposed to environmental toxins with an ApoE3/4 or an ApoE4/4 are at greater risk for cardiac involvement. Those are the people in my practice that develop POTS syndrome and cardiac arrhythmias, as well as having some issues neurologically, because it does cause neuroinflammation. So these are the factors that actually cause you to have genetics and epigenetic abnormal expression. So when we're a child, we don't, it does, you know, we're not expressing our genetics abnormally. But as we age, we're exposed to harmful toxins such as mold, such as environmental toxins, pesticides, herbicides. I had probably one of the worst cases I saw this week of somebody exposed to herbicides that I've ever seen in my life. It was like his face was almost melting. He wasn't even close to the herbicides. They weren't even being, it was, you know, like a half a block away that they were being sprayed, but he was so sensitive. Why? Because he had a previous exposure to molds, which now is making him more sensitive to other toxins. So that's the whole thing that a lot of people don't tell you, is that once you've been exposed to mold, once you've had mold issues, it makes you more sensitive to other toxins, even toxins in foods and other things. But what causes us to express these genetics and epigenetics abnormally is exposure to toxins. Age, because as we age, we increase our inflammation and all of that. Diet, if we have a bad diet, that will cause us to express incorrectly. Inflammation of all types, stress. If you're in a stressful job, that can cause you to express genetics incorrectly. Or your lifestyle, and even medications. There's certain medications. So we like to know what medications you're actually on when we know that. So I just want you to know that diet matters, and that's why I have this in here. This was a study that was done. I always reference studies because I teach doctors and I give CME, we have to have references for everything that we do. This is an old one, but I still like to include it because it was done at University of California in Los Angeles. But what they did is they found that fructose and high fructose corn syrup actually altered hundreds of neurological genes, brain genes. And so what it did is it led to a larger amounts of neuroinflammation. These same scientists, after inducing this in rats, they found that they could reverse it by giving high quantities of omega-3 fatty acids. You have to be careful with that because omega-3 fatty acids can also contain mercury. They're not all the same simple. Neuroborreliosis, that's another thing that can happen with mycotoxins. The cytotoxins effects of environmental toxins on glial cells. A very interesting article. This article actually went on to say that these environmental toxins really cause a lot of inflammation in the glial cells, causing the microglial cells to become inflamed. And as we know, the brain affects the rest of our body. The brain affects a ton in our body. So if you go on PubMed, which a lot of people do, there's over 400,000 PubMed articles on mold and mold toxicity, 400,000. Some of these are prevalent for animals, but some of them are actually human as well. So some of the old literature stated that there were 36 diseases associated with mold exposure. The newer literature is going that there's up to 94 diseases, including brain cancers, associated with mold and mold exposures. That's why it's so critical that we have clean homes. We're all going to be exposed to some mold sometime. So I don't want us to get overexcited about it, but we need to be diligent in what we're doing, how we're having our homes clean. Why do you think that Mold Pros comes and inspects my home on an annual basis? Because I've been sick from this. I want to make sure that I am healthy and that my home and my environment is as healthy as it can be. So I want you to make sure that you have this corrected. This is kind of how different toxins can control genetic expression and cause autoimmune diseases. Kind of interesting. This is about metabotyping. That one's kind of, so these are some of the diseases according to neurological literature that's actually in textbooks. So this is a textbook case. These are the 4 major diseases that are associated with neuroinflammation: Alzheimer's, MS, Parkinson's, and ALS. So with these 4 disease programs, I have seen that some of them are not truly a Parkinson's case, not truly an ALS case or an MS case. In other words, they don't have the true amount of that disease. They had a disease that was exposed, they were exposed to mold or mycotoxins. And when they were exposed to those things, that is what caused them to produce the symptoms like ALS or Parkinson's or MS. So as we removed those, the molds, they got better. Early on, this is early signs and symptoms of neuroinflammation: chronic pain, fatigue, fibromyalgia, and depression. All of those we see all the time. I'm going to have a complete list. These are the things that can cause neuroinflammation, and these things I see every day in my practice. So symptoms of neuroinflammation. This is a complete symptoms of neuroinflammation: brain fog, low-grade fevers, chronic inflammation, leaky gut, high blood sugar, because it can affect your pancreas. These mycotoxins can affect your pancreas. They can affect your bowels. They can cause IBS. They can cause, I had a history of Crohn's myself, and I have not had a history of Crohn's, and my Crohn's has been in complete remission ever since I realized that I had an issue with mold. And when I removed that, and I am diligent to stay on track of mycotoxins, I don't have any issues with Crohn's anymore. So I'm not saying that's your case, because there's a lot of reasons and a lot of causes for Crohn's, but that was my cause. That's just me. But we don't know that, but you've got to understand this, all the sensitivity to EMFs lately, that's a big thing lately. EMFs a lot of times are worse in people that have been exposed to molds. And those people actually will have pretty significant EMF sensitivities. I used to have EMF sensitivities. I don't anymore, but I'm still careful with it, but I don't anymore. Why? Because I have actually treated my body and I keep myself healthy. I make sure where we're at with mold exposure. When I get into a mold exposure place, I try to make sure that I am detoxing my body and I'm taking care of myself diligently. The other things for neuroinflammation are hot and cold intolerance. That can actually be a thyroid problem, because we know that people with mold exposures have an increased risk for Hashimoto's, thyroiditis, and hypothyroid. So here's some of the testings that I do. There's peripheral blood markers for blood damage and blood-brain barrier dysfunction, and that was done by Cleveland Clinic. Some of the other things, I'm not going to go through that because that's kind of complicated. You know, there's other immunochemistries that can be used to specifically look at cytokines. I actually showed those in the beginning. all the cytokines that can perhaps be involved with neuroinflammation. So MRIs, back as early as 2015, there's been written literature that just a plain MRI can follow and show neuroinflammation. They specifically look at vascular, cellular, and interstitial components. We know that gadolinium that's given for an MRI actually takes up areas of the inflamed tissue, and that area comes out really bright on an MRI. Here's what we call neuroquants. So I do a lot of neuroquants in my practice, and I do neuroquants because it really helps me to see the areas of the brain that are affected by mycotoxins. This was actually one of my patients who actually was having cerebellar ataxia. The cerebellar ataxia, you can see it's down on the right. You can see that the cerebellum is not lit up on the left side. It is on the right side. And that was actually not actually found initially by the radiologist. I had to have him go back and reread it. So here's somebody with mold. One of the treatment modalities that can be used for mold is hyperbaric oxygen treatments. So this is somebody who had a MRI, and this is the post MRI, which you can see increasing vascular flow. So mold actually causes constrictions of the circulatory system. Here's a similar thing. So this was in some people, mold really likes the frontal lobes, and you can see the frontal lobes before the hyperbaric oxygen chamber and then after. So their frontal lobes became more alive, alert, and they had better things. So neuroquant test, actually it helps with TGF-beta-1. That affects the tight junctions, and they destroy the mycotoxins, can clearly cross the blood-brain barrier. That's some of the labs that I look at. There's a plethora of labs that I look at. Mold actually will cause a lot of inflammation. There's going to be some literature coming out soon, hopefully. I know that the pre-studies, I don't know if it's qualified yet to be released, but I know some of the previous studies that are being done at some of these places. But mold, as far as inducing autoimmune diseases and autoimmune issues neurologically. So you can have anti-acetylcholinesterase issues. You can have concerns with anti-cerebellar. So the antibodies increase with mold exposure in those areas. So you can have a whole list of autoimmune diseases. We can also see that mold will affect the white matter changes, the structural volume losses. You can see that on the neuroquants, and the caudate nucleus is an area of the executive functioning is actually an area of a biggest concern. And when you see that, it's kind of a big deal. So some of the early signs that we see from environmental toxins, biotoxins, or mycotoxins, molds, are headaches, demyelinization, seizures. I have a ton of patients with seizure disorders secondary to mold exposure or environmental toxins. Nausea and vomiting is extremely common. I have to tell my story because I've been lecturing so much lately. I've been to California several times, Las Vegas, Texas, South Florida, Georgia. I've been all over giving lectures. And last weekend, I was giving a lecture to a bunch of physicians. And because I'm very highly sensitive to mold, I knew that the place was moldy because immediately I get vertigo. That's my big thing that I get is vertigo. But what happened to me is the place was so moldy, I started having nausea and vomiting, and it was pretty excessive. I had a hard time being able to stay in the lecture hall for 3 days and give lectures, but I made it through. I made it through. Asthma, shortness of breath, air hunger, kidney disease. I'm seeing that is increasing dramatically lately, and it's almost always related to biotoxins or environmental toxins. Excessive fatigue, because you have to understand mold, the mycotoxins, the biotoxins, they like to affect the mitochondria. The mitochondria is a bilipid layer, That bilipid layer will take up these toxins, they'll reside there. Mitochondria is where you produce 90% of your energy every day, but you have to understand the mitochondria is like the brain, it's like a microchip for the cell, kind of like in a computer. So that mitochondria actually helps to interpret, there's a direct correlation between the nucleus. So it helps to interpret your DNA. So it helps to interpret that. You can have a misguided interpretation secondary to mold exposures. It's a big deal. I love this publication because it says neuroinflammation, the devil's in the details. And so I think that this was published by Ohio State University. So these are university studies and all of these things. So here's an integrated approach to neuroinflammation and psychiatric disorders and neuropathic pain. So this is done by Skaggs University. So Skaggs University, one of the few universities that you can get a PhD in toxicology in. There's getting to be more now, but it was one of the few universities, Skaggs Pharmacy and School of Pharmacy. But what they found is that exposure to mycotoxins and biotoxins, mycotoxins, kind of same. I mean, I use them interchangeably, but they, even though there's a little bit difference, but for all purposes, it's kind of the same. So biotoxins actually, they can create psychiatric disorders. So psychiatric disorders can range from a variety of things, depression, different, you name it, all kinds of psychiatric things. But the most common is depression. And I can tell you a story, what happened to my daughter, extremely intelligent, always happy-go-lucky, always extremely intelligent, just really loves life. When she went to college, she was staying in a dorm room. At the end of her first semester, she came home, she was home, and then she went back and she said, I just could care less what I do in life. I could just lay in my bed and I wouldn't care if I even died just laying here in my bed. And so my wife and I went up to her college and immediately when I went into the dorm area, which males weren't allowed in the dorm area, but we were moving her out, so I was allowed in there. I realized that her area of her dorm was extremely moldy. And so she has, like my entire family, we all have, we call the mold gene or the genetics where we have a difficult time with mold and moldy areas. So that was her issue. So we had to clean her up, get her back. She's now almost finished with pre-law at Penn State and she's doing great. So these are biomarkers that can, for psychiatric disorders that actually can be, they're inflammation markers that you can actually measure, and they actually will go up in exposures to mold. So some of the psychiatric disorders associated with neuroinflammation are bipolar disorders, autism, schizophrenia, major depressive disorder, OCD, suicide, and neurosis. So what do I see primarily in my practice? A lot of OCD, but we do have some people who have been severely exposed to it and they develop a neurosis. And it doesn't matter what we do for them. It seems like that's where I'm having a hard time realizing how to reverse that part of it. All the other ones I think are pretty well, we can take care of and improve their symptoms a lot. So this is a cool article. So mold can be affecting your mental state. This was published in March 26th of 2020. So it actually, they found out that a lot of hospitalizations actually were related to mold exposures. Kind of interesting. So it's coming out, and it's coming out more all the time. And we need to be diligent to make sure that your physicians are actually attuned to what's going on here. So mold causes memory issues, psychological issues, focus issues, word recall. So word recall is something I see very early on in mold exposures. Confusion. You don't know the number of people I've had have confusion issues with mold exposures. They will be coming to my practice and they get lost. And I know that Florida has so rapidly changing because of all the people moving here and road construction and all this stuff and all the new buildings going up. I mean, it's been, the last 2 years have been an explosion in growth here. And so some people can get confused because things don't look like they used to. But a lot of these people, they can't follow simple directions. They can't even follow the Google search. So they get so confused all the time. Chronic fatigue, anxiety and depression. I see that every day, anxiety and depression. Yeah, it can be due to other things, but you need to really consider mold and mold exposure when you have anxiety and depression. And then neurotic behavior. I see that all the time too. So these are some of the other things that can cause neuroinflammation, traumatic injury, infective process, toxic metabolites, autoimmunity, and genetics. Genetics is usually because of an exposure to something. When we become exposed and you have chronic illness, that can lead to emotional issues. And those emotional issues need addressed at the same time as you're addressing the mold illness. Because if you don't address the emotional part, we can't totally get better. And I have to be honest with you, I've had to address that myself. I'm a totally open person, and my wife will tell you sometimes I'm too open. I just tell things as it is. You know what? I had to address that myself. Why? Because my numbers were better. Everything looked better as far as my labs and everything else. And I really was feeling pretty much better, but there was still an aspect to me that wasn't quite right and wasn't quite improved. And the reason it was is because I had to address the emotional status that was left behind from being chronically ill from mold and being discounted by a plethora of physicians. And me as a physician being discounted by my peers was very disheartening. And so I know how you guys feel as well when your physicians don't believe you. So there's 800 PubMed articles on chronic illnesses as related to psychological illness. So it can be one of those things that can be related to it. See, these are some of the things I do at first. CBC, CMP, TGIF-beta, ACTH, VIP, MSH, ADH, C4A, C3A. These are kind of some of the basic blood work that I do when I have somebody come to me with environmental toxins or biotoxins. So that's kind of my things. Then I also look for gastrointestinal things, and this can be done through a lot of different labs have this, zonulin, actin, biome. So we look for those things. We need to skip through that part. The other thing I always look for in people with mold exposures are heavy metals. When you have mold exposure, heavy metals can make it more difficult to remove the toxins that you're accumulating neurologically or peripherally, even if it's no neurological involvement. So you have to make sure that there's no heavy metals. So 65% of Americans have high heavy metals, 65%. That's a ton of people with heavy metals in our society. And these heavy metals can cause skin disorders, neurological diseases like Parkinson's, cardiovascular disease, autoimmune disease, kidney disease, exogenous and endogenous. There's two sources to damage. These can damage the DNA. the mRNA, all those things can be damaged. So here's some of the heavy metals. This was a mold patient of mine that when I tested them for heavy metals, they had these two heavy metals as well, nickel and thallium. So I want to make sure about all of the heavy metals. Yes, I've seen some people with uranium toxicity and mycotoxins, extremely difficult patients, and they have a lot of destruction to the mitochondria and the cellular layers, and they have so much fatigue. And gadolinium, notice gadolinium's on there. So you have to look for gadolinium as well, because people who've had a lot of MRIs or other exams looking for what's wrong with them, this gadolinium in some people is going to accumulate. Yeah, we're supposed to get rid of it, but in some people it's harder to get rid of. And so we have to detox that gadolinium to actually help remove the biotoxins as well. So all toxins, I don't care what toxin it is, they all create oxidation. All toxins increase inflammatory responses. All toxins displace proper elements. So they're going to displace amino acids, and amino acids are critical. But why? Because amino acids help you develop something called peptides. And I'll get to those in a minute because I use peptides in my treatment modalities. Not for everybody, but for some people. We also, amino acids are also used to create proteins. So there's a plethora of proteins that are used in our bodies. Some are for detoxification. And then all toxins like the phospholipid layer. The phospholipid layer is this cell layer, the outer layer of the cell, and also the mitochondria. Those are two very key important issues that we've got to make sure that we're cleaning those out. And I have a very specific way that I do it. So just looking at a white blood cell count can actually you can actually see if you have a toxic burden. And these tests have been done. I have the reference down there. So these tests have been done a lot. So white blood cell count, I look for it all the time, because it can give me a key. Do I need to look forward and look deeper into toxic modalities? So this is part of that metabolic code that I use, but notice at the bottom, the very bottom, the white blood cell, 3.4. So it is extremely low. So this person actually had mold exposure, unbelievable mold exposure, had been living in a moldy place for 15 years, 15 years. And you would never guess it because this person was doing everything else correct, eating everything organic, taking lots of supplements, proper good supplements. They weren't bad supplements. A lot of people take horrible supplements that are actually full of toxins themselves. But actually she was doing well. But you know what? When I saw that, I'm going like, oh, you have other issues. So then it turned out, yes. Telomeres. Telomeres are a result, and telomeres actually help you fight off some of the issues from mold toxicity. Something to lengthen your telomeres can be done kind of soon, and I do use a supplement for that. So this was telomeres and brain tumors. This is about the hyperbaric oxygen chamber, which I think they're kind of cool. I think they're great, but it actually helped lengthen telomeres. There's another product that I use that actually helps lengthen telomeres. So telomeres help with neuroinflammation. They help with cognitive decline. There's a 2019 article and a 2018 article that found that telomeres were associated with mood disorders and mental health disorders. They're also associated with increased cardiac disease, short telomeres. Of course, if your short telomeres are too short, you can't fight off viral infections, and it can lead to death. Here's something else I use in my treatment modality. It's called RG3 or synapsin. And synapsin or RG3 This is it is actually a supplement, but you have to have a physician write for it. There's new literature that just came out on this product that it actually helped with post-viral inflammatory conditions and what we call long haulers conditions. Now we're calling them long haulers because of the new virus that we just had recently. But that's RG3 is kind of cool because it helps in so many things. So it helps with traumatic brain injury, transient ischemic attacks, memory, Alzheimer's, Parkinson's, ALS, seizures, neuroborreliosis, cognitive mold. So I call it mycotoxicosis, neuromycotoxicosis, what I kind of call it on my end. That's not a formal thing, but an overall low energy. So this is an innovative patented compound that is made from ginseticide, which is part of ginseng, but it's a specific type of ginseng that's only created in a certain part of the world, not here in America, actually. And that, so it has to have ginseticide 3. So it's not 2, it's not 4, and it's not 1, it's 3. And this is the one we know helps to fight neuroinflammation and calms down the mitochondria and the microglial cells. And it really helped me get through my mold exposure this last weekend. So when you have mold exposure, I want to look at your genetics. If you have CBS mutations, perhaps you might need some molybdenum. You have to be careful on when you're introducing this and when you're not. And molybdenum, usually you need smaller amounts, not larger amounts. So it needs to be a real small amount. NDUSF, I use a product with ornithine. If you have HLA, DRBQ, then a lot of times I'll use forms of glutathione. I like a nano form that's not in a lipid molecule because remember, all these mycotoxins are already liking the lipid layers. So you need a water-soluble nano form of glutathione, a water-soluble form to actually penetrate through that and actually detoxify and help with that. So glutathione has over 400 functions in the body. It's extremely important. Number one is remove from the infected area. Make sure that, you know, if it's your home, that you're getting your home treated professionally with people that really know what they're doing. And I know mold pros can't remediate everybody, but I can tell you that they are some of the best. I've had many patients go to other people that had other places and have their house mold remediated. And then what happened, they weren't getting any better. And I said, I don't think your house is clean yet. And what happened was they actually, we actually had to have mold pros go in. They looked at the place and they found out that it wasn't remediated correctly. And they still had high levels of mold and it was horrible. And it had to be treated correctly. So make sure you're getting it treated correctly. So as far as silver, EDTA in the nasal wash and nasal spray, I don't use that commonly. So mold, as far as mold growing in the sinus cavities, it's extremely rare, but it can happen. But it is less than 2% of people. It's less than 2% of mold toxic people. But it's still there and it can be an issue. And so we use that. This is just other things that we've seen used, and that's NAD along with glutathione. It helps with the detoxification process. And this is what I feel a lot of times when I'm trying to help everybody. I feel a little stressed, but you guys also feel that way. Caregivers and my patient population always feel that way. But the patients feel that way because they don't know what to do. They don't know what avenues to go down. So I really do try to help everybody. So something that I use in my treatment modalities, not for everybody, it has to be for some people, is peptides. So peptides are natural to your body. You have over 7,000 different peptides in your body. So most of these peptides are short chain amino acid chains. Longer amino acid chains have been outlawed by the FDA to be utilized, so we can't use the longer ones anymore anyway, but we still have the short chain ones that we can use, and we can optimize you. So because they're short chain amino acids, they actually control a lot of biological functions, enzymatic functions, detox. They actually help control genes and gene expression. So most of the peptides found in your body are very short. They're like less than 20 amino acids in a chain. But all of these peptides begin to decline after the age of 21. The most significant one that declines after the age of 21, which is glutathione, GSH. Glutathione is actually only a 3 amino acid peptide chain, but it's a very large molecule, so it has a hard time absorbing through the cell because it's so large. And the other thing about that is it actually controls other peptides, and it has other functions. So the history of peptides, they've been around forever, since for a long, long time. First discovered in 1902, and that's just how they've this is kind of like the father of peptides, because he won a Nobel Peace Prize for actually being able to do a chemical synthesis, which actually was able to create the peptides in 1984. This is a peptide that I use because a lot of people, what we find is a lot of people with mold exposure actually have low, in my males, especially my young males, I'm seeing very, very low testosterone levels in a lot of these high school and college students. And it is actually related to the mycotoxins, and they actually have sequestered in the Leydig cells. The Leydig cells are actually what helps you produce your testosterone, and they have an inefficient rate for that. So what we've found is that FOXO4 actually helps to remove a lot of those, what we call senescent cells, because those senescent cells actually were caused by the mycotoxins. So if we remove them, then they begin to produce better amounts of testosterone. So this was just a glutathione model that actually showed that it worked. This is glutathione and NAD combined, and how it worked for neurodegeneration, Alzheimer's. This was actually done in mouse neurons, because they had to actually dissect the mouse to see the neurons and how it helped. But it actually helped them with their neuroinflammation. So 94% of glutathiones on the market are not bioavailable. A lot of people don't know that. There's new evidence, and there's actually some electron microscopy that has been done over in Europe, showing liposomal products and actually getting stuck in the lipid layers. So they get stuck in the lipid cell membrane and the mitochondria. This is not all of them. This is not all of them. So there's some liposomal products that are good, some that are not, but 94% of them are not good. So I use a nanotechnology hydrostat, which is a privileged information. It nanosizes the particles, and then it's delivered in a pure water molecule that has a unique water cluster to it. So that's kind of how that works. So glutathione is extremely important for the brain. It recycles in the temporal area. It decreases neuroinflammation, detoxification in the brain. It aids in the receptor sites. It has over 400 bodily functions and begins to decline after age 21, like I said before. Omega-3 fatty acids are important. BPC-157, this helps with genetic expression. So there's articles on that and how it helps with, so it helps to modulate the FTO and FADS genes. So if you need gene regulation, it helps that. Here's how peptides, GHK-Cu, actually helps with cognitive decline and genetic expression. Here's another article on peptides used as epigenetic modulators, so they actually help modulate it correctly. This article was done in 2019, so it's a really recent article. So I already told you that they're short chain amino acids. That we already said. So BPC-157 is one of the few peptides that actually is stabilized for oral use. It's 15 amino acids and found in large quantities in the gastrointestinal tract, but it accelerates healing. If you are still living in a mold environment, BPC-157 is not going to work well. You have to remove yourself from the moldy environment first. That's key, is removing yourself from the moldy environment first. So it helps with tendon repair, bone repair, decreases pain. It has direct cellular protection. It helps with nerve repair. So people with nerve problems, nerve issues and that's the injectable form. That's how it's delivered. GHK-Cu, I talk about that already too a little bit. So this dramatically drops after the age of 60. So the only people with high copper levels are people with like Wilson's disease or a genetic issue with storing copper. And you're already going to know that in most instances, but I always ask that, and I always make sure that we don't have an issue before I would initiate any copper. But it improves, it's a strong anti-inflammatory oxidant. It stimulates collagen, which everybody with mold exposure has poor collagen, very poor collagen. Promotes new blood vessels. So all the blood vessels are destroyed from mold exposure. Extremely important, extremely important. Modulates gene expression, has anti-aging properties, helps with oxidative stress. All toxins cause that. That's how it's done. C-Lank's another thing I use. It modulates interleukin-6, which that was one of those cytokines that increased from mold exposure or other environmental toxins. So biotoxins, environmental toxins, all of those things. So, but it also elevates brain-derived neurotropic factor. That's for helping you increase your brain. Very, very key. So it's cerebroprotective. I have used C-Lank in Parkinson's patients, and they do extremely well. And especially in Parkinson's patient with a depressed entity to it, it really helps them with their depression. They do much better. It's a nasal spray. So that's how that's given. C-Max is used. C-Max is a melanocortin regulation inflammation. There's also melanotan 2, which is a melanocortin. So those are different things. This is one that we can't really use. This is actually owned by a pharmaceutical company. So you'll get a cease and desist if you use this, but it used to be usable. But it helps with people. This was a study that I actually did. This was their CNS vitals. This was a mold patient, extreme mold patient. This patient was so sick from mold. So this was her CNS vitals before she was very low on all the X's in the very low area. Look at the post after she was treated. She had really severe CIRS. She had none. Almost all of them were average. Almost all of them came up to average. You know what? That is so important to me for them to have visual memory, verbal memory, all those things, the complex attention, cognitive flexibility. Those are all important things. And so CNS vitals is another thing I use. I also use VCS testing. That's what dihexa, this was an article on dihexa that was way back from 2012, and it was used in mice. Cerebrolysin, unfortunately, we cannot get right now in the United States. I don't know if we're going to be able to get it in the future. I think it's been put on hold because the FDA has put this on hold right now. But it really helped with neurological issues back when we could use it. This is how it was provided. I saw great things from it. So there's over 250 mitochondrial peptides. And these mitochondrial peptides actually help with healing. This is from the University of Southern California, another one from the University of Southern California. But it really helped with cellular inflammation and healing the mitochondria. Here's one that we do not have available yet. It's called Humanin, but it works well. It's been known to work in the mitochondria in a lot of people with neurological diseases. So keep your eye out for that. Here's a lot of articles on it. Probably the country that has done the most with Humanin, I don't know if it would be Israel or Austria. They've both done a ton of studies on Humanin. So those two countries, but you have to be careful anytime you're using that. That's a new article just came out that perhaps it could cause breast cancer. Here's some alternative treatment modalities I do a lot of times. Red light therapy, it helps with detoxification. It improves the immune system. It helps with anxiety, helps with depression, improves cognitive health. So you have to understand there's multiple modalities that can be used. And I used every modality possible. My people are so sensitive usually that a lot of times I even have to use and start with homeopathics. So homeopathics are something that I will do all the time in trying to help my patients because they can't tolerate anything. They can't tolerate glutathione. They can't tolerate one thing. They can't get in the hyperbarics chamber. They can't hardly detox at all. So that's a lot of the stuff I use. I do try to start my patients on cholestyramine. 95% to 98% of my patients do not tolerate cholestyramine. So then I'll try Welchol. That might not work in them. Then I'll try either, my favorite is called Mycobind, and that's what I'll use a lot. But you can also use okra, citrus, apple pectins. Those are good binders. The problem is some people are using some other binders that actually are the improper electrical charge. So you have to remember, you have to have the proper electrical charge to pull off these toxins because everything has an electrical charge and you have to have the proper one to actually pull those toxins out of your body. A lot of people are using things that don't really work for those toxins, but they're actually helping to remove some of the toxins in the colon. And so they do feel better because it's removing some of the toxins put off by bad bacteria in the gut, because a lot of people with mold exposure will develop a bad gut and bad bacteria in their gut. So you have to remember those things. You know, well, this is what I tell, and this is what I tell my colleagues when I'm instructing them and how to do these things and what to do. I tell them, you don't treat, you have to treat the patient, not the disease. You have to treat the patient, not a program that was instituted for these things, because not all programs work for the same, for every person. That's why you have to have a lot of things in your protocols and in your sleeve to be able to adjust to different people. So that's what I like to do, is adjust it to different, according to the person. What is that patient going to handle? That's what I want to know. What is that patient going to handle? Because you don't want to do something and then you get worse. I know, I've been there. I've done it to myself. And early on, 12 years ago, when I started doing this, maybe longer ago than 12 years now, when I first started doing this, I realized that I had to modify things pretty rapidly because you can injure somebody. And I don't want anybody injured. My first code of conduct is to do no harm. So we must do no harm. And I learned that on myself, and I've learned that with other people, that we have to kind of modulate things and modulate treatment modalities. So let me stop here so you guys can ask questions. I don't know if I'm on time or not. If I've taken up all the time, it looks like I've taken it all up.
No, you haven't at all. No, we have plenty of time. I do have one question right now, but I'm sure that other people might have questions here. Feel free to type them into the Q&A section, and I'll read them off to Dr. Crozier. That was a great talk, Dr. Crozier. Super informative. I mean, I think you covered a lot more than I was expecting. You covered like all the different, a lot of the different symptoms. I thought that was great. I think that, you hit like all the ones that I'm like very like aware of. You hit a lot of the different types of treatment. I thought it was great. The first question I have here is from Susan Sapai. She says, what is the supplement that lengthens telomeres?
Oh, okay. Well, being that you ask, I guess I can say, right? It's called TA65. TA65.
TA6, yeah. So I think I've seen them like advertised at conferences before. So
right. Now it's kind of an expensive product. I have to be honest, it's really expensive. But what they found, they've done new research with it. So you can get the lowest dosage of TA65, which is 100 units. And they're seeing results after 90 days with the lowest dose.
Well, that's good to hear. I mean,
yeah. So that saves a lot of money. I've been on the higher dose. So it's hard for me to go back down to a lower dose when I've been on the higher and I actually saw results.
Sometimes the body gets used to a certain dosage anyway. So
yeah.
It's hard sometimes to cycle down. Let's see here. I think I might.
You're exactly right.
I don't think I have any other questions right now, but if anybody's watching this on our website and you have a question, feel free to email us at the Mole Pros, and we'll try to either get an answer from Dr. Crozier or we'll be able to answer it ourselves.
Yeah.
Again, I really wanted to thank Dr. Crozier for sharing his knowledge with us today. I think it was like super helpful. I always love like hear different opinions from different avenues here. Remember, if you're in the Florida area, and do you do telemedicine, Dr. Crozier?
Yes, I do. I have privileges for almost all states. So, and I do international too. So I have people in Australia, Japan. Believe it or not, I've had a plethora of Japanese people lately with mold toxicity. England, Scotland, Ireland, Australia, you name it, every country.
Oh, good. So, no matter where you're at, so how could they, people just go up onto your website to contact you? What's the best way of?
Yeah, they can go on my website. So my website has my office number, and it has ways. So you can even email us at info at crozierclinic.com.
Great. Well, so thank you everybody for joining us today, and we'll see you again next month. Take care.
Thank you. Have a good day.
Have a good day.